Next, this week marks the one-year anniversary of the Ebola outbreak in West Africa. We've learned a lot in 12 months, including this, how robots might one day help quell medical epidemics. The NewsHour's Mary Jo Brooks reports.
This is an unmanned aerial vehicle?
Yes, it is. This is air robot AR-180 that we've been using for wilderness search and rescue.
Robin Murphy is sort of the Indiana Jones of disasters. The Texas A&M professor showed us her storage room of robot-filled cases ready to be deployed in a moment's notice.
This class of robots have actually been used the most in building collapses.
As head of the Center for Robot-Assisted Search and Rescue, Murphy has taken her high-tech teammates to the World Trade Center bombing, tsunamis in Japan, Hurricane Katrina, and the mudslide in Washington state 1 year ago. Her mission? To use robots for tasks that are too difficult or too dangerous for human beings. It's only natural then that when the Ebola crisis broke out last fall in West Africa, Murphy wanted to see if her disease-resistant machines could help.
We as roboticists spontaneously said, is there anything that we can be doing? This is a new set of disasters, a new set of issues for us.
Murphy says she knows robots will never replace the care that doctors and nurses give, but she believes it's possible to use robots for logistical support, to deliver supplies or transport waste, for example.
What we continue to hear from the healthcare workers, they want to be there themselves to help the victims. They're trying to ease suffering. So if we can let them spend their time in their suits and the time it takes them to decon and that stress to do those types of things, and let the robots do things like swap out the IVs, take out the trash, carry things like that, those are the things that are going to be the big win.
In this country, hospitals have already begun using robots for routine tasks. The Geisinger Medical Centers use robots to distribute medicine and food to patients. But Murphy says putting robots like that in a remote field hospital brings a whole new set of problems. Can it work in less than ideal conditions?
You can imagine anything with tracks, if it's a tent floor, might start catching that up and getting it caught. You've got the lip of the tent as it goes in between the doors. A lot of robots would just simply get tangled up in it.
Head goes on this end.
One of the most promising robots is the Mutt. Designed for potential use by the military, the vehicle can carry stretchers with patients over long distances.
If we move this way, it goes this way. If I move back that way, it goes backwards. Likewise, I can clip it on my belt and just walk off with it, and it'll follow me.
Clint Arnett demonstrated how it works at Disaster City, a training facility run by Texas A&M that looks like a Disneyland of disasters. On the day we visited, first responders were practicing on a derailed train, a simulated propane leak, and a fire at a mock oil refinery. General Dynamics, the manufacturer of the Mutt, is using Disaster City to test the robot in a variety of real-world conditions. David Martin is the facility's program director.
It could be utilized for transport of patients that are infected with Ebola. That would help in that it would limit the exposure of people who would be coming in contact with the patient and would make it much easier for them to move patients around without having to suit up a number of people to transport that patient.
Another potential weapon in the fight against Ebola is the Xenex decontamination robot.
And then it'll start going up so that you're going to expose all of the high-touch surfaces.
Already used in 300 hospitals, the robots use UV light to disinfect hospital rooms. Morris Miller is the CEO of Xenex.
You turn it on, you set it to run, all of a sudden the top starts lifting up, that bulb starts pulsing as soon as it's visible, and it will go all the way up to 52 inches, and then it comes back down. So it's exposing all of the surfaces in a hospital room and an operating room to this intense xenon lamp. It will literally kill any virus or spore that we've ever seen.
Simple to use, the robots are usually operated by hospital cleaning crews in 2 5-minute sessions. One machine, which costs $100,000, can typically decontaminate up to 50 rooms a day. The Xenex robots had real-world testing with Ebola last fall. The machines were in use at the Dallas hospital where Eric Duncan was unsuccessfully treated for Ebola. The robots have also been used for 2 years at the University Health System in San Antonio, and Dr. Jason Bowling says the robots are part of an Ebola response plan that they've developed.
With a patient with Ebola virus disease is that at all times we were aware where that patient was located to minimize their movement, and then to keep the surrounding areas clean and decontaminated. So one of the things we wanted to do was use the Xenex machine to decontaminate those surrounding areas. Also, if the patient did need to be transported, for example, if when they arrived, we were going to decontaminate areas through which the patient had passed, including the elevator.
Earlier this month, a study published in the American Journal of Infection Control recommended that Xenex robots be used to disinfect the protective suits that health workers wear when treating Ebola patients. Robin Murphy says it's still likely to be 6 to 8 months before robots of any kind are deployed to Africa. She concedes that with the number of Ebola cases dwindling, the need seems less urgent now. But she says all of the robotic work that has occurred in the last few months means they'll be ready when the next infectious disease outbreak occurs. In College Station, Texas, I'm Mary Jo Brooks for the PBS NewsHour.